Welcome to Tech Tuesday. My name is Abbie Ritchie, and I'm joined today with my co-host, Todd Petty. Welcome back, Todd.
Great to be here, Abbie. Very excited for the show.
Me too, me too. We have a great show outlined for you, but before we get started, let's go ahead and roll our intro. Welcome back to Tech Tuesday. I'm thrilled today to be joined with Todd Petty, who has introduced me to the folks at Kangaroo Health. And so let's go ahead and bring them on. We've got Dr. Kang with us today. Hello, Dr. Kang. Welcome.
Hey, really good to be here. Thank you so much for having me.
You are very welcome. And Chris Shore, welcome to Tech Tuesday.
Yes. Thank you very much. Looking forward to it.
Yeah, you're welcome. Dr. Kang, would you be so kind as to introduce yourself to our viewers and talk about Kangaroo Health and how you started that?
Sure. Yeah, more than happy to. So I did my PhD in medical training at Johns Hopkins Medicine. Spent 7 years there. When I was there, my father went through orthopedic surgery, but the post-surgery complication at home were not detected until it was too late to reverse it. So he actually lost a lot of mobility, unfortunately. But that also made me realize that there's a huge care gap when the patients are at home or in a facility when they're not next to a provider, right? So that's why Kangaroo Health was founded in 2015. And our mission is to use smart remote patient monitoring technology to really transform, to detect the early symptoms of the patients, whether they're in a facility or at home, and to allow the provider team to intervene, and so that patients can stay in the facility and at home independent longer and without adverse event or significantly reduce it.
I just love how heart-centered you are in approaching this. I know so many people in senior living who have created, and they've been age tech entrepreneurs, have gotten into it because something was missing. There was a gap, and you found an unmet need, and you filled that gap. So well done, well done. And yeah, you're welcome. And Chris, tell us about your association with Kangaroo Health, please.
Right. I met Dr. Kang. I was working in senior living pre-COVID and through COVID, and it became, a situation of just trying to keep people alive. I was working with doctors, geriatric physicians, and nurse practitioners that actually provided healthcare services into senior living communities. And I was always a bit confused because it was really, I didn't see a lot of healthcare aspects inside the building in terms of how do we kind of close that back door of the senior living community and keep people out of the ER and out of the hospital and make it more of a health-centered place for them to live compared to just somewhere for them to reside. So we were introduced, and there's great benefits to remote patient monitoring. It's efficient for the physician, and it allows them to become more healthcare centric inside these communities. So that was my attachment.
Yeah, I love that. I love that. And Todd, I know that this was a topic of choice for you in regards to remote patient monitoring and how it works in senior living. How have you been able to see it in effect?
Yeah, I think there are certain components that are the future of senior housing that changes from a BlackBerry presentation to an Apple. And a lot of devices have been put in buildings, and they're recording data, and we're collecting it, and we can maybe go look at it if we have time. But the world is changing to predictive analysis, machines learning what's going on with the resident. And if we're going to change to a healthcare model, which the business plan is going to demand, we now need physician visibility with our residents. We need more residents in rehab clinical care and Fynn technology to monitor mood and behavior and completion of ADLs. When you add all that together, you get longer length of stay and you get better patient outcomes. And meeting Dr. Kang and Kangaroo Health was all about a platform that's device agnostic. So you don't have to have a certain device, but how it brings the data in, brings the doctor into the building and changes lives. And so I think I feel like I'm in 2030, but I know it's 2024. So I'm excited about the conversation.
Awesome. Awesome. Yeah. So let's talk about the many benefits to senior living residents, to owners, to operators. And Chris, would you please answer that for us? In your opinion, what are the many benefits?
Well, from a physician perspective, I think it represents efficiency. They know based upon the data being monitored, which in our case, Kangaroo Health, we take care of the monitoring of that data. So what we're not doing is dumping our bricks on the desk of a physician who's already, too busy to get through the day. So we take care of the monitoring, and it provides a protocol for that patient once they start in the direction they don't need to be going and a critical event could happen. We have the opportunity to then exercise those protocols, contact the physician. So it keeps his patients healthier. It's efficient for his day because he knows, or he or she knows, who they needs to be seeing. It keeps people out of the ER, out of the hospital. In senior living, when I first started working, it was about heads in beds, and it keeps people in community. So we don't lose them out the back door to potentially never return. So from the operator perspective, it also, there's a significant, the revenue opportunity behind it is there also.
I love how you say that you don't just drop a data brick on a desk.
Yeah.
Because so many, you guys like that, so many of these new technological advancements and innovation, they create data, right? And if you cannot interpret the data and do something practically and do something quick with it, what difference does it
Becomes
make,
meaningless.
right?
Yeah.
Mhm.
Yeah. And what Dr. Kang figured out is really the full cycle of there's no surprises even on the front end, in that they contact the patient's insurance to verify coverage. So there's, the physician or nurse practitioner isn't going to get an angry phone call from the son or daughter saying, Mom and Dad just got this huge bill. So, it's just a full cycle solution that doesn't take up it represents efficiency for everybody, isn't a time constraint for anybody, and provides a better healthcare outcome for the patient, which is what we should be most concerned about.
Awesome. Todd, let's talk about the AI-powered dashboard. I know that that's a topic you always enjoy, so let's talk about it.
Yeah, no. So the AI is going to change the world because we're going to have machine algorithms building other algorithms to gather the data and interpret it. And Dr. Kane's product was the first one that I saw had this capability. And remember, she's sharing this data with the physician. The physician's overseeing the resident, and he can or she can bill for this. And CMS wants to pay for it because they know if they pay for the oversight of this data, of the vitals of the residents, going to keep them out of the hospital. But I'm going to pass this to Dr. Kang so she can talk about the AI functionality with her platform.
Yeah, awesome. Yeah, so on the technology side, we build it into different layers. First of all, from patient experience level, we know that we are interacting with senior residents, generation population. So we're using the devices we're using is a smart device that's cellular based, meaning they transmit signals in real time without using any smartphone, without using Wi-Fi, like a Bluetooth connection. It's a plug and play, very easy. And there's no learning curve for senior users to use it. And that's first place. And second is that one of the reasons that we are super excited with Fynn is that we are integrating with their EMR systems. This way we can really cross-referencing data points to build a 360 degrees on the residents. So we not only know their vitals, their symptoms, we know how they're deteriorating or improving on the behavior side as well from the on-site facility staff's input. So we can build predictive analytics to say, okay, based on all these data and these profiles we're building from the patient reported facility reporting information, we're able to say this patient is likely to encounter XYZ down the road. So the provider can step in too early to curb that escalation from their side. And in addition that as Chris and Todd mentioned, that we are putting a clinical staff monitoring those paid residents. So this way it doesn't create any workload, but also all the results escalation points are validated on the first layer. So make sure there's no false positive. And then the provider will be introduced to bring in, to step in. And so this way, we really take care of the majority of the day-to-day operations, and provider only be introduced at the point they need to. So this is like a risk stratification triage that we do. And so this way that through this, we're building the analytics to predict the patient outcome. And this way we can guide the behavior for provider and also the on-site staff to keep the residents recover well in the facilities and keep them longer. And on the other side, as Chris and Todd mentioned, it gave a layer of transparency to the patient's family member who choose the facility, right? So this way, give them a comfort, understanding, oh, my mom and dad is doing great, or maybe like there's something I need to step in to help them. So I think that's really bring all the stakeholder together through these technologies.
Yeah, I've heard you mention staffing several times, and I want to touch on that because in senior living, there is such a gap in the staffing and the workforce. So how does something like this benefit the staff?
Yeah. So on the staffing side, that's one of the key reasons that we provide our monitoring staff without relying on the on-site facility staff. So the staffing side, there are two layers. One is the remote monitoring team that can house staff. Basically, then these are nurses trained and specialists to really looking at the patient's alerts and cues and to identify like touch points, meaningful touch point with patient, validate patient symptoms to see if the patient needs to be escalated to the provider level. That's the remote workforce. So this way, the provider or the on-site facility, they don't need to provide extra eyes to look at more things on their plate. So that's number one. Number two is that because we know these residents, some of them may not be in a full capacity to really like to use it daily to keep up compliance. So we offer on-site staff frequently job by to the on-site facility to help to do the rounds to make sure the patients or the residents are able to utilize this. And through this combination, we're able to achieve really high, almost like 100% compliance for all the residents. And number two, it actually reduces workload for the on-site staff because they don't need to do their extra rounds. We do it for them, and we don't have any technology or staffing dependencies on the local assisted living, independent living. So this way, they don't need to really, this is add-on at zero cost to them, but also become an attraction for the patient's families, patients like their stakeholders, the community, to understand how the patient's residents are doing. So that's kind of our staffing level.
I want to touch on two questions that our participants submitted. The first one is from Brooke, and Brooke asks, how are care metrics on residents updating the family? Chris, you want to answer that one?
Well, there is the opportunity for the family to have access to be able to see the monitored results on their loved one, be it mother, father. So there's an opportunity. And, I think over time, some people will opt into that, some won't, but families, if they're, and again, this takes some of the workload and some of the, maybe I'll call it a distraction away from the staff, because I've seen countless opportunities or times when communities get worn out by families wanting to know how mom and dad are doing. And this is then an opportunity to say, here's login access. You can see what we see. So they feel like they're kind of, as we've referred to stakeholders, they're now in the show, in the know, and they understand what mom or dad are going through.
Hey, and Abbie, I've got to jump in here because what we're doing is we're taking their data and put it in our Fynn companion app. And that app is already hosting mood and behavior and ADL completion rates and medicine. And now we're going to have those vital signs to share with the families. And this is a positive thing. The industry needs to know that with limited visibility, with some information, the families will be very happy and feel like they're your partner and they're connected with you in the care of your mom. You leave them out and they're in the dark. And of course, we don't want to give them too much information to overwhelm them. So this is the beauty of this solution, to be able to share with that in the moment of how mom and dad are doing, so they can partner with us on their overall successful aging.
Wonderful, thank you. And I want to address the next question in the chat. And let's see, how long does it take for a facility to onboard into this program? And is there a lot of integration needed?
So I can take that question. So basically, it's actually very easy for patients' families to basically the only one meeting. They just need to have one meeting with the provider overseeing the facility. So that goes through a quick phone call or telehealth, depending what the provider and patients are comfortable with. And through a quick conversation, basically, patient give consent to the provider to join this program to participate. Then from there, then the caregiver health system will finish the enrollment, basically, and then the device will be given to the patients on the facility. So this way, it's really plug and play. There's no extra integration because we're pre-integrated with Fynn at that time with their EMR. So on the patient's level and family level, there's no integration whatsoever. So like basically, as soon as patient give us a yes, we can typically enroll the patients on the same day. So it's very quick and easy.
Oh,
Hey,
I
and
like
Abbie,
that.
too, I wanted to share for our audience too. So a lot of people are thinking, oh, we have to integrate with our Wi-Fi. We have to integrate with our low voltage. And what does that look like? And just to emphasize what Dr. King said earlier, these are tied to cellular data. So when you open the package and the device is there, it automatically connects to cellular data. You don't need additional infrastructure, and we're ready to go to monitor the resident.
Yes.
Yeah, I love it. And is it complicated to train staff on this or to stay up with the new features?
Actually, is that as we mentioned, like because this device, first of all, is a plug and play. Patients open the
Yeah.
box, and then it's ready to be used. The form factor exactly same as what they have seen in the hospital or off the shelf in the pharmacies. Secondly, we do offer the on-site staffing layer, which is we send people or the provider group send their own people to do the on-site support. So this way it saves the facility staff from doing extra work or worry about using the device and so forth. Because our on-site staff we send over will make sure that help the patient do it, make sure the patient stay compliant. And even for patients, like say maybe a little bit mental health wise affected, they can still participating, stay on top of their vitals and symptoms, make sure they're doing aging in place well.
Got it. Got it. Well, I'd love to hear from each of you at this point where you see the future of this headed, because I'd love to talk about future innovation and where you really wish it was going. Todd, you want to step in and answer that?
I am so excited about this quest we're on to educate senior housing, because to me, this is the answer we've all been asking. It's how do we change the model? And these components of Fynn technology software, one ecosystem to monitor the mood and behavior of a resident and identify when they decline, adding Dr. King's model of assessing vital signs of weight and dehydration and respiration and saturation, and a doctor overseeing that, and them working with somebody in the building, a rehab clinical oversight to help that resident. This all keeps the resident aging in place. When we are helping them before there's a decline, we're not losing them out the back door, and we have an answer for value-based care. So that's where the future is. And we just have to change our thinking and leave the past behind and move to a hospitality healthcare model with these components. And we can increase NOI, we can start transacting again, and we can have buildings ready for the baby boomers that are all going to be over 65 by 2030. And we're going to have tremendous pent-up demand. But we've got to shift now, and we've got to embrace AI and machine learning. So that's my quest.
Got it. And Chris, how about you? Where do you see the future of this heading?
That's a tough act to follow. That was very well said. It allows us to play offense rather than defense. To this point, I think, we're grounded in the past of, should we call 911 and have an ambulance show up at our front door and send them out? Or do you think we can handle and triage here? And this is using great technology to our benefit, to patient care, to people living longer. And Todd's point about, the baby boomers, and we need to get in front of this. And if we're not getting in front of it now, we're going to be playing from behind for so long. So it's our opportunity to take a leadership role in this, and everybody wins.
That's right. That's right. And Dr. King, tell us, in the crystal ball of future innovation for kangaroo health, what do you see?
So I think one thing we're really excited because through the collaboration with assisted living, independent living facilities, we're able to support, as Fynn, as Todd and Chris said, like those resident aging in place. But also through this remote patient monitoring, we actually can also link the neighboring communities with those facilities and also the overseeing providers and rehab centers. Because this way we can build like those center will acting like an anchor point to really support large communities that senior aging that in place, maybe at their home, near a facility and so forth. So this way we can really support building up its infrastructure. And in addition, the amount of insight that remote patient monitoring technology capture is really unmatchable in comparison because we have longitudinal data to see the patient's progression. That's the first time. It's truly different from the kind of the medical visit. You see a snapshot of that once a year. So this way we're able to really and consider the patient risk factor and to add in corresponding services, corresponding triage at the right time for the right reason. And in addition, on the higher level, imagine we're building out for regional and national level, we're able to see the prevalence of different conditions, of different treatments and so forth, and using those data to drive different implementation of projects, intervention, and so forth, and more innovation on top of the data. So we're really excited. I think as Todd and Chris mentioned, like with the AI, with the amount of data we're gathering, we're able to better support the decision making of the providers, of the rehab centers, of the families, and also reducing the workload and without increasing the cost for the assisted living, independent living. So we're super excited for this market. And I think this is really giving the super tsunami that the world is facing, not only in US, right? I think this is an answer to address that growing, aging, well in place population. So we're really excited for that.
Yeah, I get it. I get it. I want to ask you now the Steve Moran question, and that is, you mentioned cost. How much does this cost a provider?
Yeah, so that the answer is that, so basically we have a national fee schedule, and then considering us as an implementation partner to provider offices, as Todd and Chris mentioned, is that there are national reimbursement per patient per month to providers as incentive to give this benefit to the patient geriatric population. So the provider, let's say they get in reimbursement in X, and then basically we're not doing any fee splitting whatsoever, but they basically pay us for the implementation fee. And then the implementation fee is a lot lower than their reimbursement amount. This way, that's become a revenue generator for the provider as well. But at the same time, the patients concretely can get benefit. The facility doesn't need to incur expense, but enjoy the benefit, enjoy the marketing angle to attract new families. So it's a win-win. We truly see it's a rare opportunity. But also, as we scale up with more data support, case studies, we want to, as the healthcare transition to value-based care, we can demonstrate that this reduce ED visit readmission, generate significant cost savings for healthcare systems, for facilities. This way, there is an angle from the cost saving wise to support the sustainability, sustain this program in the value-based care setting. But under the reimbursement setting, as we mentioned, is that the reimbursement provided really good avenue to cover the cost and create a top of layer like revenue, like a margin for the providers as well.
So Abbie, just for the operators out there, just for clarity, the physician is billing for the service. Dr. Kang gets paid for the triage of the data and the model, keep holding it. The operator owner pays $0 in this situation. They get the physician having visibility for their residents in their building to help them monitor them 24 hours a day as the regulations require of us.
Yeah, basically.
What would you say is the savings then to a community or to an operator?
Sorry, what's the question again?
the savings? What would be the savings then on workforce, on paperwork, on monitoring? Is there such a number around that?
So Dr. Kang, I'm going to let you answer that, but I'd want to get my data in first. So we've been tracking a trailing
Okay.
12 data on this,
Okay.
and we've had, of the communities we've reviewed, we have one less move out per month per resident over a 12-month period. We have found services that we weren't billing for that we were providing. And then we also had a savings of staffing, because staffing running around trying to get all this stuff was eliminated now that we had it via devices and via the algorithms in our Fynn. And so total savings over a 12-month period, we saw $750,000 of NOI return to the bottom line in the community. And as all of the owners know, that gives them a new cap rate if they're going to sell. That gives them the opportunity to have an acquisition and to cover those debt service coverage ratios. So this saves money tremendously, as you said earlier, on staffing. And we can share that data with people that would be interested in seeing it. Sorry, Dr. King, I had to jump in there, you know.
No. That's a great data point. On top of what Todd mentioned, in addition, is that we are able to, through clinical studies, effectively reducing ED visit and readmissions on the senior residents for high risk events, from anywhere from 30 to 80%. So that each of that event saved, it means that residents can stay in the program, stay in the facility much longer, rather than transition to skilled nursing and downstream facilities, leaving the facility. So that's also the revenue that we help the facilities, the operator, to capture. Otherwise, they will lose that. So that's another form of saving we generate for them that's significant as they scale their population.
Wonderful. Thank you so much for answering that. And with just a couple minutes left, how can people get in touch with you, Dr. Kang?
Yeah. So that our website is called kangaroohealth.com, and they can feel free to contact us there. We're happy to do a live demo and give them an explanation on the reimbursement, ROI analysis, so they can see how this works. It's really plug and play and very easy. And also they can contact us at hello@kangaroohealth.com, as they see on the screen, so that to looking at our demo and understanding kind of how the implementation. We have a very structured implementation, and to enable a plug and play, and this will become part of the patient intake precise for the facility as well. So really looking forward to that.
Thank you. Thank you. And Chris, how can people get in touch with you for more questions?
I can place my email address and contact information in the chat, and I will do that here momentarily, so anybody could reach out to me. But I'm in constant communication with my two friends here, Dr. Kang and Todd. So they, reaching out to them is kind of one and the same, and reaching out to me, but I'll provide my specific information.
Wonderful. Wonderful. And Todd, how can people connect with you today?
Yeah, I'd love to hear from people. It's todd.petty@fynn.io, or simply reach out to me on LinkedIn. I live on LinkedIn. Great place to meet people and reach out to me for a discussion. And I'll be glad to connect you with Kangaroo and explain how Fynn and Kangaroo are partnering to change healthcare and assist in the senior housing industry.
Wonderful. And like Anna just said in the chat, she does believe that AI will accelerate healthcare transformation, which is direly needed. And I can 100% attest to that. And I can see you guys shaking your heads as well, that you agree. So more development on this to come. And Todd, thank you for being my co-host today and over the past couple of months. We'd love to have you back sometime. And for those folks who are in the chat, we thank you so much for participating. We love to see your questions and your comments. And for those of you who are watching this at a later date, please go ahead and list any questions, and we will definitely get back to you. And with that, have a wonderful week, and we'll see you back here next week. Thank you.